Hey, good morning. It's John Wilkins, your core coach. And today we have a good guest here. It's my friend. This is
Dr. Sean Wilkinson. I'm a local orthopedic doctor specializing in sports medicine.
awesome. Awesome. Hey, man, it's good to have you on.
Thanks for having me.
Uh, Dr. Sean came, tell me a little bit about how you started coming in.
Yeah, I had some friends. We were local neighborhood guys who brought me into John initially. I was just doing some workouts at home, basic stuff, and then they said, "Hey, you should give this guy check him out." So I came in and have never left since.
Yeah, awesome. Awesome. So, what was one of the reasons why you came in? You had that shoulder, right?
Yeah, I've been dealing with chronic shoulder issues for a long time, ever since college.
Mm-hmm.
Remember, I was a college rugby player,
Mm-hmm.
and it's pretty rough, no pads, a lot of tackling, and I've had shoulder pain ever since.
Oh yeah. So one of the things that we've discussed here, because we've been together for a little while now, and one of the things we've discussed is, as an orthopedic, your job is to go work on others.
That's right.
You know what I mean? So if that shoulder's laid up, you told me that one day. You
Yeah,
said, make money.
that's it. I can't say I can't be out,
Yeah.
Use my hands, my arms, my whole
Mhm.
body, right?
Awesome. Awesome. So we had a lot of questions like on comments and stuff like that, and even people text me. And what I wanted to do is bring you on, and I have you on a multiple times because you're a wealth of information. And I think together we can help,
Absolutely.
and serve tons of people,
Yes.
just get everything right. So I do inner core work and stabilization, time of detention, grip strength, all that stuff. And when he first came in, I just wanted to make sure I was doing everything correctly, based on his feedback. And, we also got, a bunch of physical therapists around the country that we're working with and stuff like that with that bar, this finisher bar here. And so we have these questions come in, and sometimes I don't know how to answer them. It's like deciphering through what everybody says and what everybody believes and what everybody thinks. Okay. So today we're going to go through 5 of the top questions that I get asked, and we just want to hear from the doctor.
Sounds
Okay.
good.
So the first question is, how does core strength contribute to joint stability, specifically in weight bearing joints like your knees and hips?
Yeah, I mean, I think it's crucial. Not just the core itself, but all the muscles that attach. um, it's like that old saying, everything's connected, but that's true.
Mm-hmm.
So a lot of our strength and we'll say stability comes from our core muscle group.
Mm-hmm.
It's more than just the abs, which
Right.
but maybe some people out there don't.
Mm-hmm. A lot
You
of
have your
people don't.
posterior chain muscles. I mean, everything.
Yeah.
It's not just the six pack of abs.
Right.
But that goes back to, you mentioned the hips, the knees.
Mm-hmm.
Those are great. We commonly see degenerative changes in those specific joints as time goes on in age and through various injuries, footballs and all these sports, right? But I'd go even further and say, a lot of it is your low back, where some of these core muscles attach. None of us can avoid the undue stresses of gravity throughout time and life, right?
Right.
But you can try to prevent these injuries by keeping a nice stable core and strong.
Mm.
And that goes back to just everyday activities, life, but even when you're lifting, proper technique and form and making sure those muscles are able to kind of stabilize yourself to kind of prevent those injuries.
So people that are coming into your office, right, the athletes and stuff, what do you notice that are most of them? Do you have like a specific, like, kind of like a little test for them to perform, that kind of tells you what's going on and
Yeah,
how
I
something
think,
happened, or?
yeah, there's a lot of tests. It's very specific to which body part or joint,
Mhm.
you're dealing with. So, for example, in the shoulder, which you mentioned previously, I mean, there's a whole host of tests.
Right.
I mean, usually you start with a simple range of motion, or active, the patient doing it, passive, with you doing it. And there's all different variables of that. There's different types of shoulder motion, whether it be your glenohumeral joint, the ball and socket, the scapulothoracic joint, where your whole shoulder girdle attaches to basically your rib cage. And there's various strength tests. the stability test, right? But there's a lot, and it's very specific for each joint.
Do you notice because of today, where we have a cell phone, we're always, video games, you're always curved over. Do you see a big problem or a big issue in posture?
All the time. I even catch myself doing it all day when I'm in the office and I'm sitting there. A lot of our work is done on computers now and everything like that. You really have to be conscious to catch yourself from that rolled shoulder, that poor posture. That's something you've helped me with, even with lifting. Even if you're doing something that's, we'll say not even related to the core, it's keeping that pelvis up. It's keeping, your shoulders back, tight shoulder blades, and just kind of trying to keep that good posture.
Right. And I always think of that as muscles are like pulleys. Like when those shoulders pull back, we're opening up that chest.
Yep.
When we curve forward, we're closed in the chest, but we're open in the back, which we don't want to be.
Yep.
So, all right, awesome. My next question is, from the viewers, the next question is, what specific core exercises do you recommend to enhance joint stability, and how should these be integrated into training regimen? Now, that's a loaded question. So in this question, let's fix the question first.
Right. So, going back to that, what exercises, basically, I'm a big fan of this. And I'm not saying that just because I'm sitting here with you right now, but obviously, I use it all the time.
Right.
Not just when I'm training with you, but at home. I even put my 4-year-old daughter on.
Yeah. Oh, yeah.
I got the pictures to prove it. But, in general, what I tell people, even in the office, if you're unable to kind of, get in here and do that kind of stuff, it's start with body weight exercises to limit the overall impact and injury to these joints you're talking about. So one of your base core exercises is a plank. Right. Helping with the bar for just better overall, we'll say mechanics, helping with the grip strength and everything you'd mentioned. But if you're talking purely core, there's really no better exercise than just holding a plank.
Right.
And then you can add the different variations, whether you do hanging straps and, all their kinds of stuff.
Like the plank taps.
It's dynamic, right?
Yeah.
So that's another big thing. It's not just, a plank you can graduate on, and then you start doing your plank walks and all that kind of stuff.
Yeah.
So it definitely adds something and a new dynamic to strengthening your body using mostly just your body weight.
Right.
Again, try to keep it, we'll say, relatively low impact, which is increasingly important. And that's why, when I first started doing this with you, you probably remember I was gassed. I never had such a crazy workout without even using a single weight.
Right.
Just trying to hold myself up properly and engaging the correct muscles. So
right. And that's true with just everyday life. Like nobody actually does things in repetitions. Like we actually, go to the grocery store, we take bottles of water, put them in our truck. We don't actually put them in the truck, take them out, put them in the truck.
You're not doing 3 sets of 10 or anything like that. That's just not real.
Right. It's not, definitely good answer. Yeah. Not real. Well said. So, all right. So that was awesome. All right. So I'm glad what we're doing is we're getting the science behind everything, because I think, some of these questions are one thing, but some of the comments I get is a guy with his shirt off and he's telling me squats are number one, or, I'm talking about the whole body and the contraction where the movement is actually isometric.
Yeah.
It's an isometric. It's like a wall sit. You're like staying in place. Yeah. And then the contractions throughout. And the longer we go, the deeper the contraction. Right. So that's the base, Another question I have is question number 3 is, are there specific signs or symptoms that indicate a lack of joint stability that can be addressed through improved core training?
Yeah, I think there's definitely signs, right? One of the earliest ones could be simply just painful joint range of motion, right? True instability is more of like you're worried about a particular joint, subluxing or dislocating out. That's the end of the spectrum. For most areas in our body, that requires something pretty traumatic to happen, right? But commonly seen, again, tackling, combat sports, all your MMA stuff. But in general, you can get slight instability and have pain, right? have weakness with certain ranges of motion.
Mm.
So those are usually the earliest ones.
Mhm. And does that mean that because I'm out of alignment that I'm getting that?
Could be either. Could be that. It could be that there's definitely an imbalance
Mm-hmm.
on all of your muscles. So it could be past injury. It could be improper techniques. It could be relative wear and tear. So if you've been doing something wrong for a lifetime, you can develop injuries. You can develop tears and things. And that's why it's really important to kind of stabilize around those joints and build up all the muscles.
Mm-hmm. And most people think stabilizing is just the bench press, the deadlift, the squat, and all that stuff, which is partly true, but it doesn't dive deep enough.
No, there's a lot more muscles than just that,
Yeah.
right?
Yeah.
So, no, I mean, I think, those things are great exercises by themselves, but there's a lot more to it than that.
Yeah. Yeah. And do you find like when you go to like a typical gym or even college sports, the coaches and the trainers, they kind of miss a lot of them miss the boat on that one.
Yeah, I think there's an old school conventional system, right? That that's how you grew up, especially in these say higher impact sports where you're just worried about racking up the squat rack and the bench press, and that's what a lot of these guys are tested on, right?
Right.
We just had the NFL combine, and that's some of the things like how many times can you put up 225 on the bench, which is fine. I mean that's by itself maybe an indicator of certain strengths, but that's not the whole picture.
Right.
That's why there's plenty of guys who succeeded in professional sports who maybe aren't the strongest, don't put up the most reps.
Right. That's what I noticed, Like when I did my combine, I benched 225 for 36 times.
Right.
The guy who beat me in that particular tryout, he did 38, some inside linebacker.
Right.
I was at like 208 and he was at like 245, 250. But the thing was, neither of us made the team, but we were the strongest.
Right.
You know what I mean?
So that's what there's a lot more, that where you build in agility, and there's also the whole skill component of it too. But that's why it's just one part of the picture.
Right.
So
Right. All right. Awesome. Awesome. This is great information. I really like it. Um, okay. So another comment was, can you explain how core training can be beneficial or detrimental for patients recovering from orthopedic injuries related to joint instability?
right. I think
So first of all, how was that question?
I think it's fine. I don't know if there's a reason, unless you're in an immediate post-op period, why it would be detrimental, right? Especially when we're talking about mostly body weight, low impact stuff. In general, it's recommended for almost everything, right? But how is it beneficial? We just talked about it. When you have these injuries, even if it's not anything like, a joint per se, like, you dislocated your shoulder or, you blew out your knee, what if you just threw out your back?
Right.
What if it's not even an athlete? What if it's, you're just splitting firewood, you were just lifting a lot of heavy stuff, you just moved some boxes in, now all of a sudden your back hurts. So that's where it's really key to kind of keep those muscles strong, teach your body how to be able to do those things without even getting hurt.
Right.
And that's one of the biggest things I've noticed.
Prevention.
Yeah. I'm a relatively young guy. I've had a lot of issues with back pain even in the past, right? One of the biggest things I've noticed from doing this program is not just how to lift, but I feel like in all my lifts and everything I'm doing, it's more like keeping everything tight, using more of the actual core muscles to prevent these type of injuries.
Not that,
Everything.
Yeah.
Right?
Yeah.
Glutes. All of your back muscles, that posterior chain. But in addition, abs, obliques, everything.
Yep. And it's funny too. So the five inner core muscles are, you got your diaphragm, you have your multifidus muscles, you have your internal obliques, you have your pelvic floor muscles, and you got your transverse abdominis. So everywhere I've traveled, I say, where is your core? And they tell me where the core is, and they start just with here. And then we go a little deeper, but nobody knows those five muscles.
That's right.
Right?
Yeah.
And
I wouldn't have known them until medical school.
Yeah.
Yeah, right.
Exactly. So we don't fault them for not knowing, but I do say that in all my learning, I always just wanted to make sure that my client got the best. And that meant me going deeper and
Right.
deeper and deeper. And then 30 years later, I've gone deep, you know? And the thing is, I'm still trying to go deep. That's why you're on here.
Yeah,
You know what I mean?
that makes sense. I mean, because I truly believe that, if you get everything, it's not just isolation exercises anymore. This isn't the old school days of, just racking up weights and doing these isolated, do chest one day, back one day, biceps one day. I mean, you can get everything together because that's how we're using it on a daily basis, right?
Right. Absolutely.
Yeah.
Yep. And so the last question, okay? We got a last question, then we'll wrap it up with I have a specific question for you. Um, so this one, how important is it to address core stability as a part of a comprehensive approach to prevent injuries in athletes, particularly those engaged in high impact sports?
Yeah. I think that's why I might have jumped the gun earlier, but that's why I think it's critical.
Mm-hmm.
For athletes and even, common people alike. But I believe if all of your muscles are stabilized and the ones you're not traditionally working out, you will be able to prevent a lot of injuries,
Right.
both in training for those sports and actually during those sports,
Mm-hmm.
whether it be, wrestling, football, lacrosse.
Blast
You name
double,
it. Yep. I mean, there's something to be said about your body being able to absorb impact with all of the muscles as opposed to just a select few,
right.
And that'll keep not just you safe and hopefully healthy, but it'll keep your joints a little bit more stabilized so you don't run into these issues, these problems that you're seeing.
Well, it seems like a lot of people aren't doing it, and we hope they actually do it. But because they aren't doing it, you have a job for a long time.
That's right.
Yeah.
And I think maybe one of the biggest reasons why they aren't doing it is because they don't know, right? You don't know what you don't know.
Right.
Just like, I wasn't doing a lot of the stuff that you taught me before coming in here.
Mm-hmm. But you knew it. You had the education.
I knew a little bit about it, honestly. You've taught me a lot just about, there's certainly how you're doing the exercises, the proper form, the technique. I knew about all the muscles names and I know what they do, but it's a different story with applying it.
Gotcha. That's a good answer. Really good answer. So he comes in with me once a week for over a year now. We've actually do a lot of training, and we do a lot of you know talking about the evolution of fitness and how fitness is developing and how it's changing over time and stuff like that. He sees a lot of patients, my clients who I didn't even realize because I didn't know them before my clients went to you. And as I talk more and more about you, people are like, oh, I go to him. Oh, I went to him. I went to him. He's a great guy. All that stuff. So what I want to do here is for the last couple seconds, I want you to tell people, just kind of a little bit of an overview of what we talked about right now. And then I want you to close it by telling everybody where you are and all that stuff, the name of your practice and
So, yeah, I mean, just, in summary, again, firm believer in overall, we'll say core strength, but using low impact exercise, right? Building it as part of your daily routine to not only help treat, we'll say, maybe chronic issues, but to prevent new issues, right?
Right.
And I think that is one of the, literally one of the guiding principles, and I've adopted it into my daily life, my daily exercise, my daily everything, right?
Right.
Between sitting in the office, like we talked about, with overall good posture, no matter what exercise or lift you're doing, whether it be for chore or fitness, kind of engaging your muscles. And then, yeah, I mean, to kind of just prevent my own, orthopedic problems in the future. And again, whenever recommending to a patient, always go over the core strength, flexibility, which we didn't even really talk about, which a lot of this stuff can help, and just an overall program about developing these muscles that most people are unfamiliar with or don't know how to train.
Right. And it's funny, I just got had a client tell me that he went to you And the one of the things he said was he loved you because you didn't push surgery on him.
Yeah.
You allowed him to try to see if he can heal himself up on his own.
For most things, that's it kind of depends on what I guess the issue is, right? But I consider myself relatively conservative. I mean, if you need surgery, you need surgery, right? But a lot of times, our body has this natural propensity to heal itself. Again, depending on what it is.
Right.
So, that's what I'm a firm believer in. So I would always try to help, guide people in that right direction.
Awesome.
And that's kind of what my specialty is I'm a general orthopedic doctor after medical school, did an orthopedic residency. Then I did a fellowship in sports medicine specifically. I did that out in Cincinnati, Ohio, with a group called Beacon Orthopedics, which covers the Cincinnati Reds and a lot of other local college and high school teams. And, my main focus, I mean, obviously it says sports, so, you always try to get the, athletic population, but it's not just, teenagers and that level, it's everyone. I consider myself an athlete, though recreational. So there's those weekend warrior patients, patients who are just, doing Spartan runs in addition to pickup basketball and all those kind of things. And, my primary focus is, shoulder and knee issues, but we definitely see everything and kind of treat a little bit of everything. Located technically in Andover, New Jersey, part of a group called Premier Health Associates. We have a couple of different offices though, but I'm based out of the Sparta location. I live and raise my family. So.
Oh, nice, awesome. Well, hey, thank you for coming on. This is pleasure. One of my best YouTubes already. All right. I want to thank Dr. Sean for coming on and sharing with us and kind of clearing everything up, because, some people, like you said, they know what they know and they don't know what they don't know.
That's it.
But with the things that they don't know, they kind of make up along the way. So I'm happy just to, clarify and, get this all situated. I appreciate everything, brother.
My pleasure.
Thank you for coming in.
John.
All right. Thank you.